Welcome to the Owensboro Public School System. This week we are taking a deeper look inside dental health. I'm Dave Kirk, and today I'm joined by Dr. Taylor. Dr. Taylor, thanks for coming on the show with us. Dr. Taylor, just kind of tell us a little bit about yourself.
I'm a dentist for the Community Dental Clinic. That's a clinic here in town at Mayfair Drive. We are a clinic that accepts a lot of Medicaid patients. We see probably about 60% children, 40% adults. And then we also see patients that are low income, and we base their fees upon their income that they have.
Sure. You know, why do you decide to kind of do some of that kind of work, like, you know, to work with that kind of set of kids, especially kids, because I know you work with a lot of kids in our schools.
Exactly. Now, I came from a lower income family when I was a child, and I know that access to care can be difficult. I myself as a child had a difficult time, and so I feel like you know, kids really can't help oftentimes the situation that they're in, and you know, when we do screenings, you see a lot of kids that have infection or large cavities, and your heart just can't help but go out to them. And a lot of times they really don't know how to communicate the discomfort that they're having. And there's nothing like just really easing the fears that a young child has. Sure. When you can do that and win them over, that's really rewarding.
Well, I guess we'll get to our topic. You know, why is dental health important? You know, a lot of people, you know, as far as, you know, when they think of health, you know, they might not think of, you know, taking care of your mouth. But, you know,
right.
Why is it important? I know it can lead to, you know, if you don't take care of it, it can
right.
lead to a lot of other issues.
Right. Well, studies have shown connections to heart disease and low-term birth weight, and just affecting your whole body. Those bacteria that live in your mouth when you have decay can really affect your entire system. And it's really important to children because we're really trying to develop habits early on that's going to lead them through the rest of their life. So what may seem like not a big deal to have a cavity on a baby tooth now, that can lead to a habit that turns into an adult tooth that has a problem. And then, as I said, the heart disease and those serious issues.
Sure. Now, I know you brought some supplies with you. Kind of talk about, what's this yellow guy here? What is this guy all about?
This is one of the puppets that we use at the school system. Whenever we're talking to kids, we're really trying to bring it down and make it fun for them, and we'll show them brushing techniques using our large toothbrush here in his teeth, and he even has a little squirt bottle out here that'll spray at the kids, you know, kind of catch them off guard. But it's just to make it fun, and the kids love this guy. We'll read Dr. Seuss' Tooth Book to them, and just do little different activities with them. So
sure. What are some tips that, you know, people can use every day that really can, you know, prevent problems from happening?
Well, specifically for children and for parents working with their kids, you know, first of all, parents should set a good example for their children, have good hygiene themselves, which means brushing 2 to 3 times a day and flossing. And when you do brush for 2 minutes. And then for kids, really, adults, parents should be helping their children brush really until the age of 8 to 10, really depending on the dexterity of the child, and at the very least watching the child if they're brushing, and then really making good, just healthy diet and drinking choices. You know, in the day and age that we live in with all of the energy drinks and Mountain Dew, there's just a tremendous amount of sugar. You know, we used to worry about kids drinking too much juice, and now we're hearing more and more kids will say, well, I've drank Red Bull and I've drank
Sure.
Monster, and we're really trying to deter, you know, and again, it starts with the parents, with the adults in the home. If they see someone drinking that, the adult drinking that, they take an interest in it. And so set the example, and then just follow through and really stay on the children.
You know, a lot of kids too with studying, I know they like caffeine, that kind of thing.
Mm-hmm.
If they refuse to just give that up, what's a way they could, I guess you could say, you know, combat that? You know, if they are going to drink those, you know, what's I guess you could say a tip for them? Well,
diet is always a better choice than the full-on loaded with sugar. You know, coffee, it's really how you sweeten your drinks is the most important part. And then also, where a lot of people get in trouble is they do the slow sipping. They'll get the big gulp drink, sure. And they'll just sip on that. If you're going to drink some caffeine, it's actually better off to you're better off to just drink that drink and not sip on that all day long, because you're just bathing the teeth in the sugary acid.
Sure.
So.
Would something like you know, brushing your teeth, I guess you could say, after that, would that?
Absolutely. You know, if you're going to do it, if you can't help but have that sugary drink. Even just drinking water. If you're not able to brush at that point, just drinking water afterwards. Tap water has fluoride in that, and that really strengthens teeth and it rinses away all those acids. But brushing would be probably the best choice.
Sure.
Yeah.
I know a lot of kids really don't understand the importance of flossing. Kind of just talk about that a little bit.
Right.
I mean, a lot of kids don't think if they brush their teeth, everything will be fine.
Right. Well, when we treat kids and when they have cavities, and a statistic that's out there is 60% of children will have decay in a baby tooth while they're in elementary school. And a lot of that decay is in between the teeth. A toothbrush has a hard time getting there, so floss is the best way to reach in there. And a lot of kids struggle with having the floss like an adult would. So they make the little animal guys that have just one little string, and those kids can use that. And when we go into the school system, we always try to put a goodie bag in the hands of a child, and frequently that goodie bag will have an animal flosser in that, and that's much easier for the kids to use. So it makes it fun, it makes it easy for them.
With dental health, why is now, for those that might not know, why is now a good time to talk about it?
Well, I would like for every month to be Children's Dental Health Month. So we'll just take our 1 month that we have. Anytime's a good time to talk about it. It's always important. It's year-round, every day, all day. It's important. But there's a lot more studies, a lot more research coming out, especially in public health, just showing the lifelong effects of early childhood caries and decay. Kentucky has received recurring each year a score of a C from the Pew Center on research on oral health. And that really has a lot to do with just access to care. A lot of people feel that they don't have, if they say they have Medicaid, they feel they have a difficult time finding a provider, but there are providers out there like the community dental clinic that accept them, and then also just lower income families. So, the research that's out there in the public health field has really shined a light, especially with the connections to their overall body health. So it's a good time. People are becoming more and more aware of the importance of good oral health.
A big question I think parents would have is, some of them, like you said, might not have the resources to provide, a regular, I guess you could say, dentist, every 6 months to their kids. What advice would you give them? I mean, to look into you guys? I mean, I guess, how's that process work?
Well, first of all, you need to determine whether or not you qualify for Medicaid. A lot of people are surprised to find out that they actually would qualify for Medicaid. And with the Health Care Reform Act that's come out, actually that's going to add a lot more families who previously did not qualify will qualify now. So that's the first step. If you don't qualify, then an organization like ourselves, with the help of organizations like OMHS, Good Samaritan Foundation, the Hager Foundation, those groups have made donations to us to further our cause, and that really allows us to adjust down that cost, the out-of-pocket costs that a family would have. And another statistic that comes out of the public health field is one of the top leading causes of a missing day of school for a child. One of the top 3 is oral pain, dental problems, and that in turn results in the parent missing a day of work, and so the economic stress just from that. So we really emphasize prevention. In the long run, it saves everyone money. It saves the entire healthcare system. It saves the parents a lot of money if you take care of the problem and stay on top of it before it becomes a problem.
Sure. For some of those kids out there that, let's say, maybe they're younger and they've never been to the dentist, and they look at some of the, I guess you could say, the negative stereotypes. Oh, it's going to be so painful, that type of thing. What advice would you give kids like that?
Okay. Well, first of all, we really love to see kids on their first birthday, so we just get them used. We just bring them in when they're 1 year old, and we just look in there and count their teeth, and that's really it. And then for anybody that's older, say they're they're 6, 7, 8, 9, 10, 11, 12, whatever age, we have adults that have never been to the dentist. But, really just come in. It's not that bad. We're going to meet you with a smiling face. We're going to tell you everything that we do. And, if you've been doing a good job, there's a good chance you're going to walk out there with no cavities, cavities free. So.
Sure. Well, Dr. Taylor, is there anything else that you'd like to add or just make the public aware of?
Well, if anyone has any questions, please call the Community Dental Clinic. Our phone number is 691-6205. And if you have any questions about access to care, would you qualify to come see us, I'd be more than happy to speak with you. My staff would as well. And if you have any questions in regards to just oral hygiene, oral health, the American Dental Association, their website, ada.org, really lists a lot of great information. And we should, there's a good chance we'll be seeing your child or you in the schools.
Sure. Well, thank you, Dr. Taylor, for joining us, and I appreciate it.
No problem.
For the Owensboro Public School System, I'm Dave Kirk. Thanks for watching.